I want to talk about this. So, Kwach, but
Yeah.
not to fair, bro. Amani, aje.
Fair, it's like a basic need.
Oh, it is a basic need.
Yeah,
It's an essential.
People are needy in these streets.
Oh, sorry. And now, if you guys are still sending hiyo fare for some of you, najua kuna vile COVID imewakataza kutuma hiyo kitu. Now, did you know that the biggest tuma kitu sender since May has been the government of Kenya? I don't know if you guys knew this, but it is. Now, the information is only useful because the government has announced that they will stop the weekly stipend of 1,000 bob that they have been sending through mobile money since May to over 300,000 households to cushion them against the impact of coronavirus. Labour and Social Protection Cabinet Secretary Simon Chelugui told Parliament that the payments would be terminated in the first week of October. But I want to ask Cindy and Kwach this. Did you even know that this was a thing that was going on? Or it was just me?
No.
Okay.
I had no idea.
Hey,
and
okay,
I'd really like if somebody commented and let us know if they received this money, because this is another Jack Ma scandal coming to be. It would be great if somebody said, hey, I got the money, here are the M-Pesa transactions. Because saying you got the money could just be some publicity stunt. We need receipts. I had no idea the government was giving people stipends. 1,000 shillings a week? Oh my goodness, this is ridiculous. It's like back in the day I learned that there were affordable houses that were built in Kibera. So guys, they cleared off a patch of land and they built houses, and they told the guys, okay, the guys who are living in that area, in the shanty houses, they said, give us 2-3 years, you'll move into this house, we will sell it to you for 10K. Let me tell you right now, if you go, the Range Rovers that are outside those houses, meant for the people who were cleared out, they sold their houses, went back to Kibera, still living in the shanty houses, cooled the money, and now there's somebody who is owning a 2-bedroom or 1-bedroom flat in Kibera next to Ayani, and they bought it for 10,000 shillings. So I would really like to hear from somebody. Maybe this has happened, maybe we are not the target market, but whatever that case might be, it would be nice if somebody came out and said, hey, me nili receive, ndo hizi receipt.
I think, Cindy, I think what you're saying is long-term solutions to, short-term solutions to long-term problems. But I didn't know about it before today, but when I asked around after I had, when I saw the story that it was being stopped, I was actually shocked to know that people were actually receiving that money. It was being sent. And a cousin of mine received it. And to these people
for how long, Kwach?
It has been going on since, apparently, it's been going on since May.
Okay.
These people apparently receive 1,000 bob per week on their phones since May. And I saw the story, the government has been spending 1 billion shillings every month in this kind of project. What I'm asking myself though, now that they will be stopping it in October and COVID is not stopping in October, what's the plan?
Right.
I mean, well, first of all, let's just, I don't even know how, if this was a project that was already in planning, where they had already talked about it, they had planned for it, shouldn't they have planned for a bit longer than May, you know, when you're talking about, it's just been a few months, it's like 3 to 4 months. So maybe they would have planned for about a year. And then, you know, this is, I think, akin to the stimulus stipend that they're getting in the US, where it's 120,000 if you, you know, exchange it to Kenyan shillings. 1,000 bob per week, it's an effort, I understand, but then I don't know how many people that feeds.
But you know, Amina, also something that's very interesting, the juxtaposition of this story and the MPs asking for, I think, 100K a month for the rest of their lives. It's just...
So this is what I don't understand. And Cindy and Kwachu can back me on this. Do you sometimes wonder why we don't have, you know, cancer machines for 1, 2, 3, 4? We don't have enough hospitals for 1, 2, 3, 4. And then all of a sudden, we have enough billions to pay former Prime Minister. We have enough to pay, you know, for building houses of all these people and blah, blah, blah. Do you wonder where that money comes from? Okay, great.
I think I come from the health sector. So I know a little bit, especially about non-communicable diseases. The big diseases, the ones that are infectious, like HIV, those are the ones that get a lot of funding because, you know, the people of the West find it very interesting to fund us. Oh, these guys have malaria, HIV. They've dealt with it. They don't have the money for it. They don't need it. So they give it to us so that they can also purport their agenda. Now here, when it comes to non-communicable diseases, it's not sexy. You know what I mean? There's nothing fancy about cancer and diabetes and hypertension.
They're not picture perfect.
So they're not well funded. funded.
Yeah.
And right now, one of the issues that we're facing is because of COVID and most of the government hospitals being epicenters of treatment, cancer patients don't have a place to go. So now they're being forced to go to private institutions. Wouldn't it be nice, Amin and Kwach, if we had that the government is renovating or changing one of the stadiums to be isolation units? Because it breaks my heart that there are people who are COVID positive and are symptomatic but are being turned home to go and cure in the house because there's no space. Wouldn't that be nice? But our agenda is no, let us give 100,000 shillings. Back to the story of this 1G. I hope it went to the right people and somebody did not call their relatives who are living in Buruburu in a 2-bedroom apartment for 15K and said, you, andika jina yako, at least tupewe kathao kila wiki.
Of course, Cindy, that this is Kenya. That has to happen.
I'm so sure that has happened.
That has to happen.
I'm so sure that has happened.